What is the most important quality to look at when buying a dental practice? Right, we're at the basics. What is the most? The very most important quality to look for in a dental practice is collections. All right, now that answer disguises a lot of information. I'm going to give you that information. But one of the underlying assumptions that I'm making with that answer is that you are clear about where you want to live. Okay, location is a do not pass go, do not collect $200 piece of the puzzle, and you got to get that right, of course. But my assumption is you know where you want to live, or at least you know about where you want to live. So given geography, what's the very most important thing to look at when you're looking at a dental practice to buy? And the answer is collections, collections, collections. Why collections? Well, let's start with a benchmark, all right? The benchmark number to look at for collections in a decent dental practice to purchase is $750,000 in collections minimum. I'd like to see $800,000 plus, but use 750 as a good benchmark, as a thumbs up, thumbs down metric on whether or not a practice is probably worth looking at. Now I say probably because collections obviously can't be the only thing that you look at. There are all kinds of other factors that we'll get into in other videos. But if you want the most important factor, it's collections all day long. Collections tells you a lot about a practice. It tells you how many patients come in. It tells you whether or not it's decently well run enough to collect the kind of money year in and year out that's going to sustain you as a dentist. Collections tells you whether or not staff stay in the office and whether or not they like working there. Collections is a good indicator also of demographic trends in the area and what type of dentistry needs to be done. Collections contains a lot of information, and you can make some pretty decent assumptions simply by knowing the amount of collections in an office. So if 750 is the benchmark, let me ask you this. Why not buy a practice collecting 1 million, 1.5 million, $2 million? Now that's a question you can only answer for yourself, but there is a tipping point on the other side of the scale where practices get too big for one doctor to do on their own. There's a school of thought in the acquisition world that you should buy as giant of a practice as possible. Usually the motivation behind that advice is money driven. Now I'm not against you making a great living. Just realize that the bigger the practice doesn't necessarily always mean better. But at a minimum, look at practices collecting 750, 800 in that range, because those practices are going to be the decent ones you probably want to purchase. Now let's look at the other end of collections. I will often be approached by buyers who will gather some documents and they'll hand me the paperwork and they'll say, I know this practice only collects 400, 450, maybe 500, but look at this price. This is amazing. They're selling it for 300, 325. By the way, did I tell you that I have these $350,000 in student loans already that feel enormous and feel weighty and just hang over my head? I would really like to get a practice for 300, 325, because buying a practice for 700, 800, $1 million, that just feels so scary. Now, I am not here to diminish your feelings and tell you that $1 million practice loan isn't scary. If you're not scared by $1 million practice loan at least a little, you're braver than me, because $1 million practice loan should scare everybody on some level. But here is the greater risk. The greater risk is that you go buy a teeny tiny, small, maybe a modified startup practice, thinking that you're safer because you have a small practice loan. And also thinking that it is a guaranteed thing. For sure, once you get in that practice, you're gonna grow it. Those patients are gonna come flocking through the doors. Collections are gonna skyrocket, and you'll be swimming in the profits, paying off a teeny tiny practice loan. I'm here to tell you, almost without exception, that never happens. And the reason for that is almost always, and we'll talk about the almost, but almost always, the person selling that smaller practice is selling it for a reason. And usually that reason is that the practice hasn't grown and they're frustrated, or the practice can't grow, or the practice has been overwhelmed by competitors in the area and now there just aren't enough patients to go around for everybody. So beware the startup practice. It feels safer because the sticker price is lower, but it's actually riskier. It's a riskier bet because you don't know for sure that you can turn the collections around in that practice. Why am I so sure that at $750,000, $800,000 practice, with of course a higher sticker price, is a better bet? because that practice has proven year in and year out that it has the patient flow, the reputation, the staff, the advertising, all of the things that you're going to need as a practice owner to keep the collections up at that high level. So why are collections at that high level such an important piece of the puzzle? First of all, you've got student loans to pay back almost guaranteed. And in order to live in the area that you're going to live, pay for the overhead of the practice, and pay for your practice loan, you're going to need a high enough collections number that can support all of those different financial obligations. Don't forget, you're a dentist. You have to have a Tesla or a Porsche or a BMW also. You got to have that. Now, in seriousness, the numbers here actually do matter. Dental practice loans in the dental community have the reputation that they're just kind of handed out. The dentist can get any loan for any amount at any time. And that's almost true, but it's only true if the finances of the practice work. And the finances of the practice always work, almost always work, at practices $750,000, $800,000 and above. Practices under that amount, sometimes the numbers don't work. And the practice loan isn't there, not because the bank thinks that you're a bad dentist or you're a bad risk. It's just that the collections from this office don't throw off enough income to support you and all the financial obligations that come with this practice. The number one factor to consider when looking at a dental practice to buy is collections, because it tells you so much about the practice and whether or not you're going to be financially successful in that practice. There are a lot of other factors to look at, but the number one thing, the very first thing to pay attention to is collections. And the good news is, when you're sitting down with sellers, or you're getting responses to mailers that you've sent out, or you're just having lunches and meeting at CE events with other doctors, how big a practice is and how much it collects is actually information that most people are comfortable sharing. So if you're talking to someone and you're not sure if you might or might not be interested in their practice, ask about collections. It's going to tell you a lot about whether or not you can or should be interested in that practice. To find out more about collections and all the other factors that we look at DBA in evaluating a practice for sale, check out the website dentalbuyeradvocates.com. I've got a podcast, I've got a book, I've got a ton of free resources for you. There is a lot to know about this topic, but the very most important thing is collections. Start there, and best of luck.